And a good Saturday morning to you. Welcome once again to Health Matters with Dr. Jim Warner of Warner Chiropractic, 4855 East State Street in Rockford, Illinois. He's been there forever. He's a fixture on the block, and today Dr. Jim is going to help you find out what to do when you don't know what to do. Or I guess when you don't have insurance, right, Dr. Jim?
A lot of people don't have insurance and don't know what to do. So, I wanted to talk about that today, Fred. Like you said, I've been around a long time. I can remember when I first started in practice, most people had like a $100 deductible, and then after that, they paid 20%, and the insurance paid 80%, and there wasn't any problems. They didn't question things. They didn't want extra documents. They didn't have to go through any different groups of people to give their official okay. It was pretty cut and dry. And it's funny that the costs in those days were less than what they are now. So it costs a lot more now, and yet people are getting a lot less health care for their dollar, and they don't know what to do. And we've got people today that have bad insurance. You know, it's just they just don't pay anything. Had a man come in a couple days ago. He said, my deductible is $5,000, is $6,000. He said, I'll never get to that point with coming into your office. And I said, that's right. I said, you wouldn't come close to that. And he said, right. Well, what am I going to do? I don't have any insurance then to speak of. And then I get the people that don't have any insurance, that they've been unemployed or whatever. They just don't have it. Then you've got some that say, you're not on my list. Dr. Warner, you were on my list last year, but this year you're not on my list. As
far as their insurance coverage goes?
Yeah, everybody looks at their insurance, or maybe their place where they work. They change insurances. They had one plan one year, and next year's next. So I've got hundreds of people that come to me that are changing plans, and you're not on my list, or I'm coming to you because you are on my list now. Mm-hmm. And a lot of these lists are, let me put it this way, Fred. If the insurance company wanted to pay you or pay the doctor, they could do it. It doesn't have to be on the list. I mean, who made up the list?
Right.
So the insurance company makes up a list and then says, well, if you go to a doctor that's not on the list, it's going to cost you a lot more money. Well, why should that be? It should be. There are some laws in some states that are called any willing provider laws. So it should be any doctor that'd be willing to take what that insurance wants to pay ought to be the one that you go to.
Yeah, I agree with that wholeheartedly. And at least in recent years, I know that a lot more insurers have covered chiropractic, but now things are getting difficult again.
We've got some now that say, well, chiropractors, they're specialists. So if you go to your regular MD, it's $20 copay or whatever it is. But if you go to a specialist, it's going to cost you $50 a copay.
Right.
So you're dealing with that. Now, something that people should think about, look at your insurance plan. Sometimes it's less expensive if you go out of your network than if you go in your network. And you might say, well, how could that be? If I go in my network, I've got a $25 copay. But if I go out of my network, I have to pay a certain percentage. I have to pay 20%. So I don't want to pay the 20%. I'd rather pay the $25. Well, check and see what the office call is. Your 20% might only be $5.
Right.
And a lot of people don't think of that. They just look at the doctor that's in the network and think that you're saving money. And in reality, especially if you need extensive care, it's going to cost you more to stay in the network, and especially with chiropractic, which is pretty low price compared to
that's true.
Other things. So that's one thing that you have to be aware of, that maybe it's cheaper to go out of the network and be something to think about. Now, some of these insurance companies, what they do, I've gotten out of the network on some insurance companies because they actually will take kickbacks. In other words, what they do is they'll send the patient an explanation of benefits, what we call an EOB, explanation of benefits, and say that, well, we paid the doctor X amount of money and you paid X amount of money, and that's what the patient sees. But what the doctor sees is they take money out of what the doctor's supposed to get, and they pay that to another group that will work their plan. It's not the insurance company. It'll be another group that works the plan. They get 10% of the cut also. And then they tell the doctor, well, if you want to get that 5 or 10%, you got to get that from the patient. And so the patient sees a different explanation of benefits. I've had patients bring it into my office and show me what they got, and then I show them what we got, and it's two different things. And so
somebody's taking some money.
It's a kickback. Mm-hmm. It's dishonesty, and I don't want to be a part of it. So there's some plans I don't want to be on, mm-hmm. But anyway, there are people that have no insurance at all. And so what do they do? And here I'd like to recommend something to patients. Why don't you ask your doctor if there's a cash discount for an office visit? In other words, if they want you to pay the full price, let's just use a figure, a round figure. Let's say $100 would be the charge to come to the office. And they want you to pay that full amount, but they're willing to take $50 from an HMO or a PPO that they have to wait for their money. They have to do all the paperwork and everything and wait for the money to get the $50, but they want you to pay cash and pay $100.
So, in other words, if they want the business, and they probably do, it doesn't hurt to ask questions.
If you don't ask, they probably won't offer.
Right.
So, there might be one thing you can just say to your doctor, whatever type of doctor it is, a chiropractor, medical doctor, dentist, whatever, say, hey, if I pay cash, do I get a discount? Because on an HMO or PPO, you're getting a lot less money, and you've got to do more money for it.
Right.
And so that would be something to think about. No matter what you've got as far as an expense, just ask, is there a discount if I pay today? And we do that in our office. It's probably... I'd say about 20% less that we charge. Now, we just tell people that. We don't try to hide it.
Right.
If they don't have insurance, we tell them, if you don't have insurance, there's like a 20% discount for paying cash. So,
and you feel that there are other doctors and places that
I know there are.
Give treatment that do the same thing?
I know there are.
Mm-hmm.
But with a lot of places, you have to ask.
Right.
So, and there's nothing wrong with asking.
No.
Sometimes people, you just feel, well, I don't know if I should. I've been coming here for a long time. Just ask them. Say, hey, is there a cash discount? So, or if you want to go to a new doctor, you can always ask that too. You can ask them on the phone. That's something that won't bother you at all because they don't even see you.
And of course, you have a telephone. You can let your fingers do the walking and
That's
find out
it.
who will do that.
Yeah, so that's something to think about. Ask for a cash discount. Now, something that we do in our office, and let's say somebody calls and they've got a substantial problem. They've had back pain, they've had neck pain for months, weeks, whatever it might be. And it may be that they're going to need a lot of treatment. They might need a month. They may need 2 months of chiropractic treatment, and they don't have insurance. Or they've got a plan that you got to pay the first $8,000,
Right.
So what we do for them is we recommend that they go on what we call our family plan. And the family plan is set up, it can be one person. It might be one person that needs treatment for a longer period of time, so we will charge them a monthly fee. I won't say what it is over the air, but it's if someone calls our office, we'd be glad to tell them. But it's a monthly fee that's much less than half the price, just for them to come in so that they can get the care that they need, and we don't have to do any billing of insurance. And that's kind of the kicker here. We don't want to have to deal and fight with the insurance companies and that sort of thing. And if we can do it on a cash basis, we'll give them a substantial discount. Not only that, sometimes there's maybe whole families that need care. Maybe a husband and wife, or maybe a couple kids or so that need care. And that second person gets it at a ridiculously low price. Just to encourage people, we say, well, why don't you just come in together, the two of you? And there's very little difference between having the one office call and the two together, because it's not any extra time, really, a few minutes more for the extra person. And so then we pass the savings on to the patient.
So that's part of what you call your family plan.
That's what I call my family plan. And I probably have maybe about half of my patients they don't have insurance, but they say, I want to go on the family plan, or I want to stay healthy. Sometimes we have that, or sometimes we have whole families come in and they know that if they get chiropractic care, that it costs less in the long run because their medical bills go down. If you get regular chiropractic treatment, you're healthier. You don't get sick as often, and you live longer. Statistics show that you live 7 years longer under chiropractic care. So it's important that people get regular chiropractic treatment and get it at an affordable price. It'll cut back on the medical costs, and you can probably find it well within your budget.
So if people want more information, I know you can be reached online or by phone.
And what I'd recommend is, this is for my patients, but for listeners of WFEN, we will offer that this week. If they'd like to know about the family plan, call area code 815-398-8111, or look at us on the web at www.warnerchiro.com.
Okay, and that phone number again is?
398-8111.
Right. Don't give them your cell phone. 398-8111. And Dr. Jim Warner of Warner Chiropractic in Rockford. Thank you so much.
Thank you very much.
That's going to wrap it up for Health Matters today.